Good afternoon, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like to take us back to Kano. Within 1 week, we've seen the cases there rising to 21 as we speak. And I'm sure that is one of the reasons why almost everybody that spoke here actually made mention of Kano. Now, considering the situation in that state, we know that a large number of the population, they actually live in clusters. Is the PTF going to perhaps recommend a new strategy or a new approach to actually trying to make sure that the spread of the virus does not go beyond what we can manage in that state? Then the second question, I would like perhaps the DG NCDC to speak on it. Yes, it is really, really commendable, of course, globally commendable that we've managed our death rate very low. The WHO commended us for that. And also our number of patients that have been discharged, really, really commendable. Can we trace this development to anything at all? The reason why we'll maintain such a profile. And lastly, I will be grateful if the SGF will comment on this. It has to do with the federal government's zero income tax. That is one of the economic stimulus policy that the CBN is actually driving as we speak. What does that mean for workers, especially those of us who work in private companies and even the public servants who work and they pay their tax? What does that policy mean for us? Thank you.
Bonsoir, les membres du groupe de travail présidentiel. Je m'appelle Ernest Eke, je suis avec Voice of Nigeria. Je m'adresse au ministre des Affaires étrangères. Depuis l'arrivée de cette pandémie, coronavirus, nous avons vu et entendu les soutiens des organisations internationales, locales et même les individus. Mais nous n'avons pas entendu de l'Union africaine ou bien la CEDEAO, ou bien est-ce qu'ils n'ont pas la voix dans cette situation, ou est-ce qu'ils ont perdu la voix? Ils doivent au moins avoir peut-être une déclaration. Qu'est-ce qu'ils font? Ou bien c'est une situation de chacun pour soi dans cette Afrique. Et puis la deuxième question que un de nos auditeurs il nous a envoyé un message. Elle a dit que veuillez noter que le gouvernement fédéral, par l'intermédiaire du ministre chargé de l'information, il a donné des directives selon lesquelles tous les fournisseurs de services de télévision par câble, c'est-à-dire StarTimes et DSTV et les trucs comme ça, devraient rendre les chaînes locales gratuites. Mais cela ne se produit pas. Par exemple, j'utilise StarTimes et mon abonnement a expiré et il supprime tous les canaux locaux. Le gouvernement a fait cette directive pour que les gens puissent obtenir des informations sur la situation des choses dans le pays. Voilà, nous espérons que vous allez au moins nous dire ce que s'est passé. Je vais dire ça en anglais. I would say this in English. One of our listeners, he said, please be informed that the federal government, through the Minister of Information, Lai Mohammed, gave the directives that all cable TVs, service providers, that is StarTimes and DSTV and the rest, should make local channels free, but this is not happening. For instance, I use StarTimes, my subscription has expired, and they removed all the local channels. The government made this directive so that people can get information about the situation of things in the country. He wants these things to be addressed. And secondly, we have seen support from international organizations, the UN and others, local individuals too. But we have not seen anything from African Union or ECOWAS. Do they have a say in this, or is it that Africans are on their own? Thank you.
Good afternoon, the chairman and members of the Presidential Task Force, my colleagues, and Nigerians at home. Good evening, actually. Some videos have gone viral of some youths who wash their hands into a bowl and drink the water and say that coronavirus does not exist and cannot do them anything. I want to know, because such videos are capable of misleading millions of youths in this country at this time, and they are capable of jeopardizing the fight against the coronavirus. I want to know what the security and orientation agencies are doing to trace the originators of this video with a view to addressing the trend. And secondly, I'm happy the national coordinator made reference to increased interstate movement, which is not good for the fight against the coronavirus. This, I would say, has been causing serious gridlock in Abuja, for instance, along the 3 entry and exit routes into the nation's capital. And this is posing great strain on essential workers, and it appears the security agencies are not able to sieve out violators from the essential workers who actually have work to catch up with. I don't know what the security agencies are planning to do, and if I may suggest, it will not be out of place to maybe have a dedicated lane for essential workers so that they will be cleared by the security operatives and allowed to go and do their job. Thirdly, the Kano, we hear that the Kano State Task Force has reportedly transferred a Jigawa indigene who tested positive to the Dutse Isolation Center. We want to know if this is the right protocol for treatment and management of the coronavirus. Thank you.
Good afternoon, Mr. SGF. Good afternoon, ministers and my colleagues. My name is Rachel from the News Agency of Nigeria. My first question is for the Minister of Health. Sir, we have, I won't call them alleged cases of doctors treating COVID-19 patients at home. I don't know what the implications will be to Nigeria and all. Now, the NCDC boss said that we have over 400 gene experts. I would like to know if it's all gene experts that can be converted. And my last question, I would like to know if the items we got from the United Nations were disinfected by the environmental officers, just like what we did for China when they gave us those gifts. Many thanks.
Good afternoon, members of the PTF. My name is Yemi Adebayo from AIT. This question is for the SGF, and I understand so that you remember that a couple of days ago I was here to also ask you about the issue of people in Galadima, where there are allegations that there's a site is being put up in that area for mass burial for COVID-19 patients. I want to find out, you did promise that day that you are going to reach out to the FCT administration to actually confirm how true this is, and if there's any measures. I want to know whether you've been able to confirm from the FCT minister on this. Then secondly, I want to find out, the NCDC DG, sir, you quite agree with me that electricity is very, very important and it's not so stable in the country. I want to find out, how are you planning these isolation centers? How are the isolation centers faring in terms of electricity supply? I understand that a couple of days, the Rural Electrification Agency actually installed solars in 4 centers, and we have more than four isolation centers. I want to know how is electricity faring in that place. Then finally, Abia State is yet to record any case of COVID-19. And you agree with me that Abia is a commercial hub for Chinese products, where people get to buy products from Chinese, imported from Chinese. I want to know, are you planning to beam a searchlight on Abia State to actually confirm the true state of things there, whether or not you have a COVID-19 confirmed case there? Thank you very much.
Mr. Chairman, National Coordinator, Honorable Ministers, DG, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question actually is going to the Chairman. Is the PTF considering an extension of this lockdown to beyond the 3 states that the President has currently put this lockdown? I ask this because we're seeing some other states that have even recorded more confirmed cases than Ogun State. Yes, they have their own particular lockdown, but we've seen governors, for religious reasons or whatever other reasons, lift some of this lockdown. But if the lockdown is from the federal government, I know that they don't have the power to do that. So would like to know if you're considering that. And the next question is to the DG of the NCDC. Well, we have recorded low fatality rate here in the country from coronavirus, which we're grateful for. But for these people who have died from the virus, we want to know how many of them had underlying illnesses and how many of them died from complications from the virus only, without any underlying illnesses. And finally, to the National Coordinator. Well, I have asked this question before. Unfortunately, we've not gotten any response. The President had directed that banks should be open, even though just for skeletal services. And you have also mentioned the same thing here. But unfortunately, the banks are not open. Even the mobile apps, we're finding it difficult. Nigerians are finding it difficult to transfer funds. And of course, this is not good for our economy. So I would like to get an update on what the PTF and the government at large intends to do to ensure that banks at least make sure Nigerians have money. Thank you.
Good afternoon, sirs. My name is Juliana Taiwo Obalonye. I write for the Sun newspapers. SGF, sir, this is for you. Might not be a COVID-19 question, but it's also important. We've noticed that so far, 3 government parastatals have been gutted by fire. By fire. And are these mere coincidences or saboteurs at work? And what is government doing about it, considering the fact that we are battling the pandemic on one hand and there's possible recession facing us, and then we are having this situation? DG, NCDC, or the health minister, somebody wants to know, what have the Chinese medics been doing since they've been in isolation? SGF, sir, you might want to answer this, since the Minister of Humanitarian Affairs is not here. 3 weeks into this lockdown, we are still hearing planning to, we are planning to do this, we are planning to do that. When will all this be in place so that Nigerians will begin to have access to these palliatives? Thank you.
Good afternoon, the Chairman, Ministers, the National Coordinator, and my colleagues. My name is Nancy Anika. I report for Radio Nigeria. To the Minister of Health, we would like to know, the Department of Health, the Ministry of Health has a department for alternative medicine. We would like to know their contribution so far to COVID-19. And then it's in the public domain that patients in the hospitals who come for childbirth are being asked to buy 2 pairs of personal protective equipment for doctors. We want to know how true this is and what we're doing to stop it. And then to the DG NCDC, we would like to know when the accreditation for private hospitals to test for COVID-19 actually started, and what are these criteria in the selection process. Thank you very much.
Good afternoon, all. My name is Nike Adebowale. I report for Premium Times.
So, Minister of Health, sir, this is a follow-up to Nancy's question. So, can you give us a list of accredited private facilities attending to COVID-19 patients? Thank you.
Thank you. That brings us to the end of the questions. They have been directed at the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of Information and Culture, then the SGF. But because the Honorable Minister of Foreign Affairs will be leaving us to attend to another program, I will invite him to the podium to answer his questions.
Thank you very much indeed. The question was in respect of the African Union and the ECOWAS, the Economic Community of West African States. The question was that a number of international organizations have made comments and statements about the COVID-19, and that the questioner had not heard anything from these two organizations. Well, in reality, the fact is the contrary. The African Union is mobilizing all the African Union member states and international partners and the financial institutions to write off debts or suspend debts for African countries, setting up a fund for the fight against COVID-19. And ECOWAS, of course, has an organization called the West African Health Organization, and they have mobilized huge resources and are looking to have Nigeria as a hub to distribute all this assistance, material and otherwise, to the member states around. Comme la question était en français, il a demandé si pourquoi c'est le cas que l'Union africaine, le CEDEAO n'ont rien dit depuis toutes ces crises, et comme les autres organisations internationales. Mais la vérité, c'est que c'est le contraire, que ces deux institutions ont beaucoup réagi. L'Union africaine, ils ont mobilisé le monde entier, les instances financières internationales, et puis un fonds pour les pays membres de contribuer pour cette lutte contre la COVID-19. Et puis le CEDEAO a une organisation pour la santé régionale de l'Afrique de l'Ouest, et eux aussi, ils sont en train de centraliser au Nigeria un processus pour assister tous les pays membres de CEDEAO. Donc ces deux organisations sont vraiment impliquées dans la bataille contre le COVID-19. Merci beaucoup.
Thank you. Let me start with the question in no definite order. First of all, the accredited private hospitals, none that I know of here in Abuja. I think Lagos is looking at some accredited hospitals, and there's one large hospital in Lagos that has called me and said they want to become a corona treatment center. Now, the structure of the hospital is such that they are ready to remove all the present patients they have there and do nothing but corona. That would be good because they don't stand the risk of infecting of what we call cross-infection. But if you as a private person, you want to run a treatment center, you have to show that, first of all, you have the staff. The doctor who must be an infectious disease specialist, and then nurses, and even cleaners who are trained, because the handling of this such a hospital is different from handling ordinary hospitals. So it must be trained in infection prevention and control protocols, and the hospital must be properly delineated as it is in clean and dirty areas, and you have to have an inspection by a team of accreditors who will give you the go-ahead to do it. So while it is not prohibited. There is no hospital that I know that I met that criteria at the moment. But that brings me straight away to the treating of private patients. That is not allowed. The risk is very high. This is one of the most easily transmitted diseases you can think of. In that if you are in a place with people who have coronavirus and they are shedding the virus, the likelihood of you getting is very high. And although a large number of persons who survive it, the few who do not really can be very many to deal with, and they can overwhelm a health system. And they can cause, in 5% of the cases, severe illness, and many people are severely ill, can overwhelm the health system. So it is not allowed to treat coronavirus privately, and if they get complicated, and before you rush them to the hospital, it will be too late for the person. So the earlier they begin the treatment in an accredited and certified hospital, the better it is. As for underlying illnesses, yes, it's written in the literature, and the knowledge so far is that many of the people, large majority, have an underlying illness, either hypertension or diabetes or cancer or HIV or things like, or even asthma. There are young people who suffer from asthma. Those ones are also likely to be vulnerable. So the most have had it, and I think if you look deep enough, you find that nearly everybody has an underlying illness, but that is not always clear. The youngest person that we know who had it, at least in the UK, was 13 years old, but had underlying illness also. Normally, young people do survive it easily. With the question of the Chinese, they are still in their quarantine for 14 days, it will be. But the directors and officials and technical partners in the Ministry of Health have had a teleconference, a video conference with them, in which they exchange ideas. They were able to learn a lot of things, where they brought interpreters so we could ask questions, ask about how they handle their cases, how they handle their patients, how they carried out their infection prevention. So when I got back and asked questions, everybody was very happy, and they're going to repeat another session of video conference to see what you can learn. The science is about learning. Science is not about thinking you know everything already. If you know everything, then you are not a scientist. Scientist is always curious, wants to know what the other man knows, and wants to get the information as much as possible from the other side. And if you look recently, the United States announced that they were not happy because the Chinese were not they felt the Chinese were not telling them enough of what they thought they also wanted to know. So science is about curiosity. And we want to learn as much as we can from the persons. As from PPE for women who have babies, I'm not quite aware of that. I think maybe if it's a private hospital, I don't know, but I'm not aware of that. Now, the alternative medicine, yes, we do have a department for alternative medicine in the ministry, traditional, alternative, and complementary medicine. And we have had, of course, a series of letters from traditional medical practitioners who have written to me that they have the cure for corona, and well, I have not disputed it, so I have referred such letters to the Department of Traditional Medicine, and I'm waiting for them to give me a feedback on what they have discovered from the people. I think that's all. As for the cases in Kano, well, I'll say a bit about it. The Director General of CDC will say some more. It's a very good, it's an example of what you can also learn from coronavirus, in that the very quick work of, if you get one index case and you're tracking all the contacts, and the more you are going to find, so it shows that the system is working. It's proof that the system is working. Whether all the contacts were actually very related or related, the director of CDC will speak to that. But there's a lot of quick work that has gone on there, and if you know that this is a disease that spreads easily, you know that speed is of essence. And I'll remind you again, when the first index case came into Nigeria, Within 2 days, he had developed symptoms, and the doctor who attended to him was very, very good, very fast doctor. We praise him because he referred immediately for testing. The test came out positive very efficiently. The NCDC and the Lagos team went and did contact tracing. They were able to trace. In those few days he had been there, within 48 hours, they had identified his positive status, and they traced 179 contacts, 179. And one of them turned out to be positive also. And that both of them were admitted, they were treated, and then when they were well, they were discharged. If other cases had not come in, you wouldn't have seen corona, probably wouldn't have seen corona in Nigeria. But other cases started to flood in. So you see that fast work, easy tracing does a lot of good, and NCDC does well in that respect, working well tuned in with the Lagos team and with the Abuja team. And we're trying to create that same connectivity in all the other states with the state apparatus. So I think that's all.
So thank you. There weren't too many questions. I think the first one was on the number of deaths and discharges and why we're seeing the numbers we're seeing. I think it's way too early to discuss cause and effect. So let's carry on our work and see whether what we learn about this disease. But it's too early to make any conclusions at all about our case fatality, our number of deaths, our number of discharges. Once we are at a reasonable place in the outbreak, we will compare how we are to the rest of the world. On the AU, actually, the African Union has been one of our biggest proponents and supporters. The very first test done in Nigeria was done with testing supplied a week after cases started being identified in Nigeria. So the AU has been a big supporter of our work. The first 4 people that were trained in COVID-19 diagnosis were trained by the AU. There was a training session in Dakar. We sent 4 people there, 2 people on one trip, 2 people on another trip. So the African Union has, through the Africa Center for Disease Control, is one of our most critical partners in everything that we do. On the transfer of the case from Kano to Jigawa, I won't get into the details of what is appropriate. I think the key thing is the individual is getting good care in Jigawa. Right now, I spoke to the state team yesterday. So you see, whenever there's a new case in a state or states that are having their initial cases, some of these things happen. But it really doesn't matter. If you remember at the beginning of the outbreak, Lagos was managing many cases that were from other states, from Ogun State, and were later transferred back. So really, it's really an academic discussion. It's one country, one response in terms of where people are managed. What states, there's no state that owns a case, and none of us are indigenous of a state. We're all citizens of Nigeria. The question on the gene expert machines, there are 400 of them, but only 41 of them are ready right now for COVID-19 testing. It's not that the equipment is bad, it's just that it requires an extra level of biosafety to work. So there has to be a functional biosafety cabinet in that place. So we'll start with that 41 and we'll scale from there. There's the Rural Electrification Agency, excellent partner. They've just completed providing solar in the treatment center in Abuja, and are looking at a few other centers around the country. So the Abuja one was commissioned last week. We're very happy with that, both in the temporary and permanent site. So that's really an example of many other public sector agencies that have come to the support of the response. A very good question on why there haven't been cases in Abia, and surprisingly, that also came up in our PTF meeting this morning. So we decided to re-intensify our surveillance in Imo and Abia states to be sure that we're not missing out on any patient. But we don't know why that is. But it definitely means we have to work harder, and the state teams have to work harder in those states. And there was a question about, I think Amaka asked about underlying illness. We're still looking through, many of our cases have had underlying illness, but not all of them. And it's also very hard to disentangle if you have a severe cancer and you have COVID-19 on top of it. What was the primary cause of death? What was the secondary cause of death? It's not a very easy distinction to make. So we'll be looking into that in detail. But for now, in the heat of the outbreak, we're really focusing on keeping people alive. And on the final question on accreditation of labs. At the moment, I have included this as a strategy that we'll go into. It is not really our priority at the moment to accredit private labs, but we have started. So where we think it's necessary, like in Kaduna at the moment, there wasn't any other public sector lab that was ready. We did accredit the private sector lab. In Lagos, it was also needed because we just needed to rapidly scale capacity. So our short-term goal is to scale in the public sector. As reagents become available to buy, because at the moment, it's very difficult to buy the reagents. So all the reagents used for COVID-19 testing are being supplied through our procurement centrally. So once the private sector is able to, one, have a facility that is ready to test, but secondly, able to procure their own reagents, then of course that whole space will open up. So I think that's all the questions answered.
I think we missed out one topic which I will just put in. That's about decontamination. The shipments that came were decontaminated. That's a routine process. The ones that came in from through the United Nations system and the one that came from China, they were all both decontaminated in the same process by the Ministry of Environment.
I think mine is just a single question regarding why banks have not opened. We completely agree on the importance of the public being able to access money to buy food, medicines, etc. We're not sure why the banks are not operating. I know certain aspects of the finance sector, such as the CBN, Universal Microfinance Bank, have directed their staff to return to work so that they can continue to give approvals for financial drawdowns to small and medium-scale enterprises that applied for their facilities. We will reach out to the CBN governor in case there are clear logistic reasons that are preventing banks from operating skeletal services. And where there are, we will review the protocol with regards to bank operations. Thank you.
Mr. Chairman, and members of the PTF and judgment of the press, there are two questions I'm supposed to address. The first is the one about whether the service providers, this is DSTV, multi-choice and Star Times, whether they've actually whether they're actually keeping with the arrangement and the directive of the MBC that whether you have renewed your subscription or not, you still be entitled to watch national TV stations. While I was there, I did confirm from the DGMBC, and he has affirmed that this is being obeyed by the two service providers, but that the only channels we are entitled to are NTA, AIT, channels, STV, and all state government, channels that are on those platforms. I mean, if you are looking for either Al Jazeera or CNN and you have not paid your subscription, I don't think I promised that. Secondly, if anybody who has, if you are not getting any of these national stations, please check your equipment. It might be faulty. The second question has to do with the videos that have gone viral, and in particular the one that about the young man washing his hands, drinking the water, and saying that hunger kills and not COVID-19. Well, my response to that is very simple. There's been a lot of drama around the COVID-19, and I think probably more videos have been produced in respect of COVID-19, either for or against any other situation. We have absolutely no control over what people produce. Some, they do it out of boredom, some out of mischief. However, our advice to Nigerians is that please listen to the NCDC, listen to the Ministry of Health, listen to the World Health Organization. Don't be misled by anybody. No matter how influential the creator of the video is, his advice cannot be superior to the advice that we are being given by the health authorities. Thank you very much.
A couple of questions, but I think the question with regards to Kano has already been taken by the Honorable Minister of Health. There was a question that had to do with zero income tax that is being advanced by the CBN. CBN deals with fiscal and monetary issues. I don't think they deal with taxation. If it is anything to do with tax, I would assume that it came from Federal Inland Revenue Services or some of the exemptions that are contemplated within the Stimulus Act that was passed by the House of Representatives. So I want clarity as to your question. What is it? Is it a tax exemption? From where? From where? Yeah, that is contained. As a matter of fact, I know that it is contained in the stimulus bill that was passed by the House of Representatives. You are asking whether the zero income tax, what does it mean to workers? What I'm saying is that probably that is contained in the stimulus bill that was passed by the House of Representatives. It has not been assented to yet. I know about the minimum income tax. And the minimum income tax presupposes that a taxpayer has no taxable income because of personal reliefs, allowances, or total income that produces a tax lower than a minimum tax of the rate of 1% of the total income that is payable. If that bill is passed, then there will be some exemptions contained in the bill itself. And whatever and whoever it covers, it would apply to those people. It will be speculative now to begin to assume that that will be applicable, because I know that the economic stimulus bill that was passed by the House of Representatives has not been assented to. As a matter of fact, it will need concurrence from the Senate first before it gets to the executive for assent. The other question that was asked was with regard to Galadimawa Cemetery. I have confirmed from the Federal Capital Territory, in their master plan there is a provision of a cemetery in Galadima, and that exists. In their master plan, there is a provision for a cemetery in Galadima, and that exists. There is no new cemetery that is being created for the purposes of COVID-19 fatalities. There is a mortuary that exists in Galadima. I mean, there is a cemetery that exists in Galadima, and that is in the master plan of the Federal Capital Territory. Like you have one in Gudu, you have one in Gorimpa. These two I'm familiar with. So similarly, one exists in Galadima within their master plan. There is a question here that has to deal with banks, the opening of the banks. Yes, I know that banks were the first, the CBN and the Minister of the Federal Capital Territory were the first, the Minister of the Finance, Budget and National Planning were the first to issue guidelines to banks as to how they would operate. Banks technically are operating, but online. And I think one of the things that has happened is because of the designation. When we first designated areas of potential risk, banks were classified as banking halls were classified in the, I think in the yellow, not the red. In the yellow, meaning that congregating in the banking hall can instigate or kind of facilitate infection. And I think that was what informed the decision of the central bank and the Ministry of Finance and Budget and National Planning to issue guidelines as to their operation. But you remember 2 days ago there were questions as to the need for banks to operate, particularly for people to be able to pay their custom duties, their tariffs and charges so that they can clear their goods from the port. And I was on a discussion with the Executive Secretary of the Shippers Council, whose responsibility is to help and protect the interests of shippers. And he confirmed to me that in Apapa, banks substantially are open for that particular purpose, from the hours of 9 to about 2 on a daily basis. I believe with the need for even people who have sold their items or their products to deposit the monies as we move forward. The central bank and the banking committee might have to review that policy to see if they can receive funds into the banks, because the more you keep monies outside in cash, in large consignment, you expose people to a lot of risk. So I believe that the central bank and the banking committees would look at this and probably profile a way out. I understand that, I don't know the third building that is gutted now. I know we had a problem with the office of the Control General and one other office. The third one occurred today? Oh, today. We have been busy at meetings, so I have not been able to get the news. I'm getting the third news now of the third item. Well, when there is a fire outbreak, there are certain processes that are put in place. The first is an evaluation by the fire brigade itself or the Department of Fire Services. The second will be an investigation by the law enforcement agencies to ascertain whether it is a case of arson or it is a mechanical or an electric fall. You cannot make any comment unless those particular reports are made available to you or government has made a statement on it. So anything I say about this ongoing process will be speculative, and it will not even help the cause of the investigation that is ongoing. So I would want to refrain myself from making any comment with regards to what is the subject of investigation by the fire brigade, and I know by the security agencies. Palliatives. palliatives, it's an ongoing process. We have not said we have not begun. We've started. The Minister of Humanitarian Affairs, Disaster Management, and Social Development had earlier, about 2 weeks ago, kick-started the conditional cash transfers in all the states that are participating, with the exception of the few that she had to drop because they were not doing what they ought to be doing. Invariably, all those that are in her register of 2.6 million households, I assume, have been paid. And it was because of that that the President decided in this second leg of the extension to introduce an additional 1 million households, making it 3.6 million. So, and she has reported to us too that the Empower people are being paid. The palliatives in respect of distribution of food items, which Mr. President had already approved, is ongoing. You saw her on television when she handed the consignment for Lagos State to them. She went to Ogun and handed their own. I believe that of the FCT has already been done. The distribution is through a process because they have an established structure. We understand that there are people that ought to benefit who are not covered with the initial structure. And our advice to the minister and her team is to rejig this particular process to ensure that those that have now fallen victims of COVID-19 adversities are also adequately captured in the process of the distribution. So palliatives is an ongoing process, and I believe that most of the states on their own are equally doing something for the people of their states. I believe that's about all the questions that I'm supposed to answer. Thank you. What was? I can assure you that from the record available to me, all the states that have high cases are on lockdown. I don't know of any that is not on lockdown. Even states that don't have one single case are on lockdown. Plateau doesn't have a case, but they went on a 7-day lockdown with curfew. So several states are on lockdown. Virtually all the states are on lockdown. Even those that don't even have a single case are on lockdown. I understand the need to have one uniform response, and that's what we have been trying to build, the synergy of having a one single national response. And I believe that most of the governors are keying into that. If you see, invariably everybody is extending with 2 weeks again, just to make sure that they're in sync with what the federal government is doing. The federal government's decision to take on these two particular areas, Abuja and Lagos, is because from the onset, these are the epicenters of the pandemic. Ogun was added because of its proximity to Lagos. A lot of people live in Ogun and go to work in Lagos. And similarly, the same way, people live in Lagos on the outstretches of Lagos and come to work in Ogun. So that was part of the consideration for why Ogun was added to the list. But I can assure you that there is a lot of synergy, there is a lot of momentum being built in the process so that we have one national response. If we say there is a lockdown, invariably there will be some differences on the application from one state to the other. But I can tell you that every governor is mindful of the adverse effect of the coronavirus, and they are doing everything to ensure that they align with the processes that the federal government has put in place. Thank you.
Thank you very much. That brings us to the end of the national briefing for today, Friday, 17th April. We have two messages coming out. One is that fake news is poisonous. It will only distract us from the objective of winning this war. Avoid it at all costs. Two is that stigmatization is dangerous. Please do not shun anyone who is infected or has survived the infection of COVID. Respect them and treat them with dignity. The virus does not respect anybody. It does not discriminate.